Youth Mental Health Canada conducted a survey of youth to understand their mental health and wellness needs. An estimated 1.2 million children and youth in Canada are affected by mental illness, yet, less than 20% will receive appropriate treatment. By age 25, approximately 20% of Canadians will have developed a mental illness. Youth who are engaged in child and adolescent mental health services, and who require continued services, are also often not well supported as they prepare to enter the adult mental health system. The survey in English was available online from November 2018 until June 2019. 390 youth aged 10 to over 20 from all regions of Canada completed this survey. Here are the results. Most respondents like school a little bit. More than half of the respondents generally like school. The percentage of respondents who like school a bit increases with age. The percentage of respondents who feel sick when wake up and have to go to school decreases with age. No respondents who are 10 years old likes school very much. Most respondents feel safe at school most the time. However, 13.6% of respondents do not feel safe at school. The percentage of respondents who feel safe increases with age. Most respondents sometimes feel close to people at their school. 24% of respondents do not feel close to people at school. The percentage of respondents who feel close to people at school decreases with age. Most respondents sometimes feel a part of their school. 23.7% of respondents do not feel a part of school. The percentage of respondents who feel a part of their school decreases with age. Most respondents have a school staff member that they feel comfortable talking to. 28.3% of respondents do not have a school staff member that they feel comfortable talking to. Most respondents do not often exercise every day. Most respondents sometimes talk about their problems. 6.8% of respondents never talk about their problems. Most respondents sleep for 6 hours on an average school night. 4.3% of respondents sleep for less than 4 hours. Friends and future plans motivates respondents to get up the most. Listening to music is the most popular way of stress management. 5 respondents manage stress and anxiety by weed. Most respondents listen to music when they feel stressed or anxious. 48% of respondents have used an app for relaxation, meditation, managing stress and anxiety, organizing your schedule. 17% of respondents have phoned a telephone crisis helpline or gone on a website, such as Kids Help Phone, because you needed to talk to a counselor about a problem. 59% of respondents did not know where to go or who to ask when they wanted to talk to someone about a mental health or emotional problem. 60% of respondents think that their mental or emotional health affect the grades they get in school. 67% of respondents are not familiar with any youth mental health organizations. Most respondents occasionally feel hopeless in the last 4 weeks. 8% of respondents always feel hopeless. 86% of respondents feel that they were under stress, strain or pressure, and they didn't know what to do. 32% of respondents considered attempting suicide in the last 4 weeks. 3% of respondents attempted suicide in the last 4 weeks. 35% of respondents have been prescribed medication for mental health challenge. 45% of respondents have seen a healthcare professional to talk about a mental health challenge. 73% of respondents have experienced a difficult life event that affected them emotionally and physically. The event or situation still affects 66% of respondents. Survey conclusions. The importance of healthy habits and self-care strategies was a glaring concern in the survey findings. Many young people do not exercise on a daily basis. Many young people are not getting enough sleep. Other than listening to music, the top self-care strategy used, the strategies for managing stress and mental health challenges seem to be limited. The importance, and absence, of safe people, safe places, safe school communities and caring champions was a big concern for many young people. Many young people do not belong to any clubs, associations or groups in their schools and in their communities. Safe spaces can provide a break from mental health judgment, stigma and discrimination. It also allows people to feel supported and respected. This is especially important for students with disabilities, including mental health disabilities, members of the LGBTQIA community, racialized groups and other marginalized groups. Safe spaces and safe people are a mental health tool provided much needed support and the opportunities to practice self-care and build resilience. The importance of effective coping, problem solving and resiliency strategies for mental wellness was a concern expressed by many students. Many young people do not know where to go, who to talk to or what to do when they feel challenged by life, school and health issues. Access to information, supports, services and resources seems to be a challenge that many young people face. Increased awareness of stress management, problem-solving skills and strategies and ways to build resiliency to better manage life's challenges is important. Suicide awareness, education, intervention and prevention at school. Young people are in crisis while they are at school from elementary to post-secondary. School communities need greater compassionate tools for responding to students who are struggling with their mental health so that we do not contribute to the silence, stigma, discrimination and taboos that exist. The use of trauma-informed social and emotional learning environments. There are many trauma-affected students in classrooms and we need to understand the effects of birth, life and intergenerational trauma and incorporate that awareness into teaching and learning practices. Universal trauma-informed and social-emotional practices benefit all children, building critical skills like self-awareness, emotional regulation, compassion and an openness to teamwork and cooperation. The need for belonging, connection and community. The lack of involvement in clubs, groups and associations, the lack of safety and caring adults some young people expressed in the survey and the numbers of youth who experience mental health challenges and suicidal thinking and attempts is a real concern. Decreased belongingness can result in greater mental health challenges and suicides. A sense of belonging to a social peer group can enhance students' academic achievement. Having a greater sense of belonging has been linked to lower levels of loneliness and depression. What is YMHC doing? We have created youth mental wellness resources and tools to respond to all of these concerns.